Hey there, beautiful people. I have been working with heart disease patients for over 10 years, and through that experience, but more importantly, through my latest research, I've discovered the 9 biggest risk factors for heart disease. I made a pie chart to illustrate these 9 big risks, and the 2 big risk factors that take up half of that pie, and I'm going to be showing that to you. So do you want to bring your risk of heart disease down to almost 0? Yeah, I know you do. So you just keep on watching. So hey there, this is Lindy Ford, functional and clinical nutritionist and registered dietitian and nutrition detective. Please, if you like this video, smash that like button, and also please subscribe to this channel and join our YouTube family. Follow me on all the social media outlets, including Twitter, and I am so excited that you're here. So heart disease, right? I deal with this every day in this practice. I'm going to give you the 9 biggest risk factors, and I'm going to show you this pie chart at the end. You're going to see it. You're going to see it on my social media outlets. You're going to be able to copy it. I want you to actually share it with as many people. I want to get the word out to as many people as possible. This is based on the latest research. Now I'm going to give these from the least to the greatest. The 2 biggest risk factors that are pretty much tied for 1 and 2 are going to be at the end. If you can knock those out, you have literally decreased your risk by half. That is big. So I am hearing just more and more about practitioners not emphasizing overall cholesterol when it comes to heart disease. You shouldn't be looking at overall cholesterol. That didn't even make the list. That is one of the smallest risk factors. And if your practitioner still does that, they're really living in the 90s. They are looking at research that is funded by Big Pharma. I'm just being honest with you, because statins are the #1 moneymaker, #1 seller in this country. They ain't giving that up. They're going to cling to those statins, and there's just a very small amount of the population that are even helped by them. So I'm telling you, this war on overall cholesterol, it's like it has been really debunked, and I actually call it the 21st century bloodletting. In 10 years, we are going to just say that was crazy that they emphasize that so much. And I'm just tired of seeing you beautiful people suffering with the side effects and really poor information that's not going to lead you to freedom. So I have had several patients suffer with major heart attacks, and then they've come to see me, right? But just a while back, I had one in particular. This was a male who had a massive heart attack, and for 10 years had gone to his practitioner, his doctor, and they told him he was fine. They were looking at one number, and that was overall cholesterol. We're going to talk more about some risk factors with that being too low at times, but his cholesterol was low, so they're like, you're fine, never looking at the 2 biggest or even any of the other risk factors, which he had about 6 of them. There's other risk factors that should have been a huge big red flag. Most of this research is coming from the American Heart Association, if you can believe that, and some other reputable journals. So number 9 is inactivity. Listen, we must get moving every day, 6 out of 7 days a week. You do not have to do extensive exercise routines. I did a video on that. I'm going to link it below on how to get exercise into your life, even if you're a non-exerciser. You know, they've said that like sitting all day is really the new smoking. Get moving. Number 8 is high LDL particle size. Now, some of that LDL, low density lipoprotein, it's actually not a fat, believe it or not, but it is something that carries fats. And you can't know very much by the LDL number, but you can know something about the particle size. That comes with not just a lipid panel, it comes with a comprehensive lipid panel. So you would have to ask for more. Number 7 is inflammation. And I'm telling you, I talk about inflammation all the time, and that is why I always ask for something called a C-reactive protein, either high sensitivity or it's called cardiac, high sensitivity or cardiac. You must ask for that by name, and most doctors don't run it just randomly. You have to ask for it. It's not quantitative. I'm going to link a link below just to show you what CRP is and why it's so important. So number 6 is smoking. You're just going to have to stop. I know how hard addictions are, and there's been so many public service marketing campaigns about that. I don't need to say much more about that. Number 5, I would say number 4 and 5 are pretty much tied until we get more research. And number 5 is high triglycerides. This is the most common fat in the body. And it is not only responsible for heart disease, but it is, when you have high triglycerides, it's responsible for stroke, for liver disease, for fatty liver. It is bad all around. Stop. You've got to get those triglycerides down. How do you do that? You lower your carb load and you get all of those seed oils, those inflammatory polyunsaturated seed oils out of your diet. The soybeans and the vegetable oils, the canola oils, the sunflower oils of the world are literally marrying with those carbohydrates, and the babies are triglycerides. Listen, look at my Google reviews. I've had several of my patients that have had triglycerides up at 600 and 700. I like them under 100 milligrams per deciliter. That is your goal, under 100. If I can keep mine at 70, you can get yours under 100. I'm telling you, every patient that I have worked with who's had really high triglycerides have gotten them under 100, and you can too. Number 4, which is just as bad as high triglycerides, is low HDL. This was what is wrong with many of my patients who are suffering with heart disease. They have none of that high density lipoprotein protective cholesterol. You need protection. And when you have low cholesterol, oftentimes that's linked with low HDL. And so that number goes into your overall cholesterol number. So don't forget to look at that number. Number 3 is hypertension, and that's high blood pressure. I'm telling you that I have treated probably about 500 people and gotten their blood pressures down, and many of them have gone off all of their blood pressure medication because their blood pressures just go down too low because they're doing everything naturally. I'm going to link a link below how to lower blood pressure naturally. Please, please, please watch that video. It can be done. Okay, the next 2 are pretty much tied again until I get more research to tell me which one is more important. You get rid of these 2 and you are going to lower your risk substantially and work on all the other ones as well. And that is belly fat. Through overweight, obesity, but belly fat, that waist to height ratio, where should it be? I'll link a link below to that to show you, yes, this is where your ratio to your waist to height ratio should be. That's many of my patients who have had heart disease. And that one particular patient, yeah, I said to him, I said, did anybody ever talk to you about your belly fat? And he said no, and he thanked me. He actually thanked me in my office for saying something. I thought he was going to get offended. He did not. He said, no one has ever talked to me about belly fat. I said, well, that's one of your biggest risk factors. Not that you had low cholesterol. Low cholesterol actually probably contributed to your heart attack. And number 1 is prediabetes or diabetes. Okay, beautiful people, this is 100% preventable. I'm a diabetic ready to happen with an A1C of 5.1. If I can do this, you can do this, okay? This is 100% preventable. I was working one time, I was giving a talk to a nurses association, to a bunch of nurses, right? Traveling nurses or whoever. And the nursing instructor actually said to me, she said, you know, when we code patients, she said, when we code diabetes, we automatically code heart disease. And I was shocked because that's how insidious this is. That's how I always say they're like evil twin brothers. They're not cousins like we used to think. They are twin brothers. Even if you have diabetes, some of it is, it depends on how long it's been going on, how long it's progressed and worn your pancreas down. But a lot of people can reverse it. And if you can't do that, you can manage it by not completely destroying every cell in your body. You can make it so that it doesn't progress to the next level. So here's the pie chart. I'm giving it to you right now. And these are the risk factors. I'm going to be posting this on social media. I want you to look at it. I want you to share it. I want you to get free of this. And I'm telling you, overall cholesterol did not make the list, but it does help to sell statins, and that's what it's good for. So this video should really empower you. I have had people, I mean this. I have had people walk into my office with 6 of these risk factors, and they have reversed. They have literally gotten rid of every single one of them, and I don't even consider them a risk anymore for heart disease. And that is why I love what I do. That gives people freedom. I will see you in the next video.